Welcome. Today we're going to talk about the conservative management of chronic pain. We're going to discuss how pain is affected in conditions like complex regional pain syndrome, spinal stenosis, and peripheral neuropathy. So when we talk about pain, is it really just a normal protective device that we have? And if so, what happens in the chronic patient? Why is our brain still trying to protect us? So what we need to think about is, in chronic pain, is this a normal state? And I believe that the brain perceives that we are in danger and it's still protecting us. That's why that chronic pain cycle continues. So it's important to find out why the brain has come to this conclusion. Now, a few basic facts. So the amount of pain you experience does not necessarily relate to the amount of tissue damage that you have sustained. So if I have two patients and we do an MRI or x-rays on these patients and both are diagnosed with severe spinal stenosis, one person might be in chronic pain, a pain level 8, and the other person, which their stenosis is equally as bad or maybe even worse, has zero pain. So when you start to see this over and over, you start to think that should we be like concluding that everybody has spinal stenosis when you see the x-rays? What is creating this danger signal? What is creating this chronic pain besides just the stenosis? So the brain really decides if something hurts or not, and that is 100% no exceptions. So if there is no pain, then the tissue or structural damage is not perceived as a threat to the brain. So how does the brain receive information? Well, we have receptors, right? We have sight, sound, smell, touch, and taste. And these senses are integrated with memory and emotion so we can determine the proper response. I mean, think about it. When you walk into a room and you smell, let's say that turkey from Thanksgiving, immediately your mind goes to that place, maybe when you're a kid, and that's where the memory is stored. So, and pain definitely is stored with emotion and memory to make sure we don't keep doing the same mistake over and over. So we have, throughout our body, we have all these little relay systems. They're like sensors. So we have temperature receptors that can tell us whether it's hot or cold. We have mechanical sensors that can tell us whether there's pressure or maybe slight pain or a pinch. There's chemical sensors that deal with allergens and toxins. And then these chemical sensors also release these positive chemicals like sodium, potassium, we'll get that a little bit later, and lactic acid. So when these sensors are stimulated, either the temperature, mechanical, or chemical, they open up these positive charged particles, we just talked about the sodium, potassium, and these neurons just open up. And what happens is this causes an electrical impulse to fire. Now, with a normal nerve, all nerves, when they get a little impulse, there's a spike, and they call this spike an action potential. So let's say there's a range, and when the impulse hits, that range, let's say, is this high. So with all nerves, there is what they call an all or nothing principle. So the spike will have to go all the way up, the nerve fires. What happens sometimes is when there's too much stimulation, that the threshold to fire becomes smaller. So let's say the normal range I said is like this. Now the range is like this. So the spike, the all or nothing, only has to go this far. So that creates these chronic pain situations, and or like sometimes that ringing in the ear, the tinnitus, that frequency of firing is so close to the threshold that any stimulation creates that nerve to fire. So we can then start to lose some what they call brain endurance. We become more sensitive to sound, maybe to light. Sometimes balance can be affected. Driving in a car for a long period can make you real tired. We fall asleep when we read a book. So when the threshold becomes narrowed, we actually affect our brain endurance as well. So these small events can create this response, And our brain actually interprets these as danger messages. So I want to explain this to you because I think it's really that important. So you can see here, this is called the mitochondria. This is basically the powerhouse of our cell. It produces what they call ATP right here. That's our energy of the cell. And when this gets damaged for various reasons that I'll get into in a second, then our body doesn't produce enough energy when we eat food, so we're always tired. That's the chronic fatigue part. And what it does, it affects this sodium-potassium pump so that threshold to fire becomes much more narrow, and then we're so sensitive to all these different triggers that I kind of just talked about. So things that affect the mitochondria are oxygen, glucose, stimulation, and then different things that create oxidative stress. So these can be bacterial, viruses, heavy metals, chemical exposure, autoimmunities. So some of the things that create, and these are the big factors right here, that create this unhealthy mitochondria are the oxygen. So if you have poor circulation, anemia, or sleep apnea, you're not getting enough oxygen to the cells, and this creates unhealthy mitochondria, which will lead to this fatigue, that threshold being smaller and smaller, as well as glucose. So we all know like insulin resistance and diabetes is not good for the brain. It's really not good for the nerves. All neurons need glucose and oxygen, and they need activation or stimulation to fire properly. So stimulation is basically exercise. Now, the best exercise almost you can do for the brain is walking. Walking is super powerful for the brain, and it's a nice little stimulation. But if you are having issues, let's say with focus and concentration or balance, or let's say interpreting sensation, different things, there are different parts of the brain that you can actually do different exercise for to stimulate that specific part of the brain that hopefully one day we'll get into, and we can talk to you more about that. Then I talked about oxidative stress. So any environmental toxin creates it, autoimmunity, the viruses, bacteria, parasites, all that. So you have to figure out the why part. What is going on with your body to create this unhealthy situation? If it's the glucose or the anemia, it's super easy to figure out, right? But those are the diabetic neuropathies. These are the folks that, their sores aren't healing so well with the poor oxygen, and their leg is starting to get that brownish color and a real, like a sheen, almost a little shine on that bottom shin. That's just poor oxygen there. And there's ways to change that, right? The most important way, obviously, is exercise and good diet and all that stuff. So our goal is to figure out the why, to get that mitochondria healthy again, to increase that frequency of firing so we're not so sensitive to all stimuli. So what's interesting is you can have a physical response, let's say, post-surgical, it didn't go right, or you had a traumatic injury, but the brain can't really determine the difference between an emotional response or a physical response. So, chronic stress, sometimes, some traumatic event in childhood or later on in life can create this emotional trauma, basically, that will make that mitochondria unhealthy, that frequency of fire, our brain becomes much more sensitive. So the nerve cells, they have to travel up the spinal cord. So our receptors, let's say at the bottom of our feet, feel it. It travels up the pathways to the spinal cord level, and then our brain has to sort all this information out. And there are basic networks in our brain that all work like a symphony. And if this symphony doesn't work perfectly, it can affect our ability to perceive pain, sensation, movement, emotion, as well as even memory. Now, if there is the frequency of firing, if it becomes compromised, that person, like I said, becomes overly stimulated to loud noise, bright lights, barometric changes. The little impulses add up, and then that person is either in chronic pain, fatigue, brain fog. So the brain, I said, it acts like a symphony. There's a lot of different parts. Like most of the brain's job is to inhibit that fight or flight response. So we're trying to inhibit that sympathetic response that we only are supposed to use for the fight or flight. But our bodies, when it gets under chronic stress, this fight or flight response becomes more activated, or if parts of the brain don't function as well as they should, it doesn't inhibit this pathway like it should. So just to kind of go over this briefly, I just want you to kind of know different areas of the brain and what it's responsible for, because if you're having problems with focus and attention, then you need to look at how to build up your frontal lobe. So things like luminosity is great for that. If you're having troubles like initiating movement, like, if you're sitting in the chair and it's just hard to get up and it's hard to take that first step, that's the premotor cortex. The prefrontal cortex is problem solving and memory. We have the amygdala, which is more about fear and addiction. So if you're having either one of these issues, you want to work on that deep part of the brain called the amygdala, which is the emotional brain. The sensory cortex, which is really important when it comes to, let's say, peripheral neuropathy, we want to be able to discriminate the different senses. So I'll do a test with somebody where I will touch different parts of their body with their eyes closed, and they tell me, am I touching them like this with 1, 2 fingers? And so if you're having issues with that part of your cortex called the parietal lobe, the sensory cortex, then I will just tell you, you are not going to get better from this chronic pain, but it can be changed. You can change your ability to perceive pain and sensation. The thalamus and hypothalamus is your stress response, and that the autonomics. So autonomics are basically things we don't have to think about: heart rate, breathing, blood pressure, that kind of stuff. The cerebellum is movement, balance, and coordination. And the hippocampus is important because it's not only our memory center, so it's what actually gets injured or whatever is not as effective like in Alzheimer's patients, but it's also our fear area and our short-term memory, basically. So our brain, like I said, it's a symphony. It's a coordinated orchestra to get us out of this danger. So what we're trying to avoid is that fight or flight response, that sympathetic response. So when we have that response, what happens is our motor system will cause us to run away, so our big, long muscles will get tight. Our endocrine system says, okay, we need all the energy we can get. Let's stop the digestive process so we get things like constipation. Our immune system says, okay, let's focus on all these little, invaders. So we actually become more susceptible to immune issues. And then what takes a hit is the other side of the nervous system, the parasympathetics. That is basically your rest and digest system. So the sensory map of the brain. So if you just go right above the ear, there's a line there that if they put little needles in, it maps out different parts of your body. Now, this is called the homunculus. And this sensory strip, it basically is what I really work on when I start to try to change that pain pattern for my patients. So here's the deal. If you look up homunculus, you'll see a representation of this, it's usually a man that has these really big hands and big feet, and they only give the lower back, a small representation on that sensory strip, but the feet are like this much. So you've had a couple back surgeries, couple injuries to the back. There's no more room left on that part of the brain to handle that sensation, so it will spill over into the feet. So part of the training that I do is I will work on this sensory motor strip on the homunculus to try to get your brain to remap the pain. Here's the homunculus. So you can basically see that they give this hand a big area, and the trunk is just this little area right here and a little area for the hip, but they give the foot and the hands these huge areas. So where most people with neuropathy, it's usually the feet and then the hands. So with peripheral neuropathy, the nerve has these danger sensors, and they can be activated by the things that we talked about: mechanical stimulation, lack of blood, the anemia stuff, stress, chemicals. And when these sensors are activated, they go up the spinal cord, and it creates all these short circuits. So the spinal cord is supposed to have like a brake pedal for pain, but sometimes the gas is kind of stuck and there's no brake. So we need to like not just work on the area of pain. That's why most of your treatment has been unsuccessful, to be honest. It's you have to work on the whole body. You have to work on the digestive issue, the dietary stuff. You have to work on the area of injury to change the sensory input there. And then you have to, and I think the most important part is you have to work on the brain, which most people, unfortunately, don't really know how to do that. So when an area gets injured and the frequency of firing becomes more pronounced, what happens is we get this hyperalgesia, which means there's too much sensitivity to the body part. So like you go to get a massage and somebody's barely touching you, oh, that hurts so much. And your response to that, you're walking on the ground with peripheral neuropathy and you feel like there's hot coals, your feet are burning, or there's rocks underneath. This response becomes so exaggerated. And then the next thing that happens is then other areas that didn't hurt now hurt. That's called allodynia. So simple things like just the covers touching your feet can create pain, or you can get just burning throughout the body. This is common when the whole immune system is so reactive to whatever stressor it is. So they're called cytokines, or these chemical messengers of the body that need to be suppressed to actually help fix that, that burning throughout that whole body. So I talked about the brain response. So it's that fight or flight response and how the endocrine system gets involved and the motor system. And it just keeps perpetuating itself until you figure out what that trigger is to calm that cycle down. So that's basically what a really good neurological exam does. It figures out where your body has issues. There are certain blood tests or stool samples or different tests that we run to kind of figure out what your trigger is. And then once you figure it out, trust me, the solution becomes a lot easier and improvement can be had. So, I've kind of talked about this a lot in my clinic is, the power of positivity. You have to have a positive mental attitude because our thoughts are powerful enough to either increase that pain if we're always in that negative thought pattern, or it can decrease that pain. Our brain can't tell the difference between what's real and what's imaginary. So if you're thinking good things and you're actually picturing yourself doing the things you want to do, that can help build up more neurons, neuroplasticity, to make a change. But if that tape keeps playing over and over, and that tape is negative, I can't do that, I can't go outside, I can't do this, then really that's how it's going to be. So you have to have that positive mental attitude. So techniques like journaling are extremely beneficial. Sometimes people, go towards religion or spirituality or meditation. Whatever you need to do to help yourself achieve that would be great. Surround yourself around people that are positive. That's one good thing. So central pain is what I see a lot in my practice. This is a combination of both brain and spinal cord issues. This is most of what I think chronic pain is, or complex regional pain syndrome, even peripheral neuropathy. So our brain doesn't inhibit, like we talked about, at the spinal cord levels, and the sensors just continue to put out this input. So the response is you get, the autonomics get involved, so that could create sometimes dizziness or balance issues. You can get all these tight muscles and chronic fatigue and burning pain. Burning pain to me is usually a sign of essential pain, and it's actually more difficult to fix because there's just more layers that we have to change. So a lot of you have been diagnosed with multiple things. Fibromyalgia, peripheral neuropathy, usually it's the idiopathic kind, chronic regional pain syndrome or CRPS, chronic fatigue, myofascial syndrome. I mean, the diagnoses are important because they at least, categorize you, but personally, I don't care about labels. I care about what my exam shows, what my test shows, and what can I do to make that change. So sometimes people come in here, they've been to the best clinics in America, and they come with this diagnosis that heck, sometimes I don't even know what the heck it means, but I just break it down, stimulate receptors, inhibit at the spinal cord level, get that brain activated, get them on a healthy diet and lifestyle, and you know what? Pain changes. So cortisol in the short term is our friend. That's our response to stress. But over the long time, it can be extremely inflammatory. It can have detrimental effects. So the normal curve is in the morning, cortisol should be high. And as the day goes on, it should slowly descend. So at nighttime, it should be very low. And that helps us sleep. So melatonin has the inverse relationship, basically. In the morning, it should be low. And at nighttime, it goes up. So we sleep. Now, if you're waking up, you're extremely tired, this whole circadian rhythm is out of balance. It needs to be balanced. I've talked enough about the autonomics, so that's basically the sympathetic versus parasympathetic, the fight or flight versus rest or digest. So if you're not digesting well, if you're having trouble sleeping, if you feel like you're always anxious and like your body just can't calm down, you have to regulate the autonomics. I talked about cortisol long term, it's not good because what it'll do is it will release these cytokines, these chemical messengers within our body that are extremely inflammatory. And then it just creates that whole sympathetic, parasympathetic imbalance. All right, so the important stuff is what can we do about it? It's hard to make change. And it's hard we get to be a certain point, we've kind of thrown in the towel. We rely on medication to get us better, but as time goes on, the medication dosage usually goes up. The list becomes longer, and when you're in that, it's really hard to ever get better. So strategies that we start with is always that anti-inflammatory diet. There's a lot of them. You can do paleo, you can do FODMAP, you can do ketogenic. You can do whichever one you're going to do. So I always say keep it simple. The more restrictive you are, the harder it is. So whole foods, chicken, meat, fish, fruits, vegetables, that's how we should all eat. Simple. We should exercise on a regular basis because that releases endorphins. It helps with our insulin sensitivity. It activates the brain and it improves circulation. Those are all big things. Sleep is super important. You need a minimum of the 7 to 8 hours. If you're having troubles getting the 7 to 8 hours, figure it out. So there's a lot of strategies that you can employ, like turn the TV off half hour, start to get the lights dimmer in your house, get off that computer, right before, make sure the router isn't in your room or your cell phone. Keep it dark in your room. There's a lot of things that you can do. And if you're having trouble sleeping, you need to figure that out. You need to do something. I personally like CBD for sleep. I think it works amazing, which we'll get to that in a second. Then you have to control the pro-inflammatory response. So our microbiome is super important. So I like a diverse, healthy microbiome. If you're eating food and your gut is bloating up, or if you're getting acid reflux, it's not a healthy environment. If you're having issues with diarrhea, constipation, it's not a healthy environment. The brain and gut talk to each other nonstop. The gut has to be healthy. They communicate all the time. So the gut needs to be healthy because 70% of our immune system resides in our gut. If the gut isn't healthy, we can't really fight the fight. And then if you're having issues with the gut, there's something called leaky gut syndrome, which needs to be repaired because when we eat certain foods, if the gut becomes permeable, these small little proteins then circulate our body, and our body looks at those as foreign invaders and attacks it. This is some of our arthritic issues, our chronic pain syndrome, our fibromyalgia stuff. So the other thing that's really important is the barrier of the gut is the same barrier of the brain. So if one's permeable, it's reasonable the other could be permeable. And what you don't want to have is a permeable brain. Leads to bad stuff. So things I recommend are probiotics. The research on short chain fatty acids are huge. I've just recently learned about that. Things like butyrate, propionate, acetate are really big. Fiber is super important. As you break down fiber, it will break down to short chain fatty acids. And actually, shirataki noodles actually gives us one of our good bacteria that we really need. So if you can incorporate that with a lot of vegetables, that would be really good. Then we have to control the sympathetics, right? We talked about that sympathetic, parasympathetic tone. So the vagal tone, different exercise you can do is gargling. Humming is good. When you're brushing your teeth, you actually stimulate the back of your tongue a little bit and make yourself gag. That stimulates the vagus nerve. Meditation is really good for it. Yoga. And remember, the thoughts are like nerve impulses, and we definitely can control what we think, so we want to be able to control that. So the positive thinking that I talked about, the journaling, spirituality, these are all really good things. In my office, I do something called Neurofeedback. We put leads on the head. I can do a mini QEEG, so I can actually look to see how the brain is firing. And if it's misfiring, I will actually have the patient come in and train their brain waves to get them to self-regulate. This is extremely effective for chronic pain, PTSD, anxiety, depression, controlling that sympathetic response. And recently I've had great results with even dementia. Okay, so my top supplements. And I'm going to get into this even more as time goes on. I'm going to break it down like, these are best for the gut, and these are best for the brain, and these are best for, controlling inflammation in your body. But these are my 5-star supplements. Number 1 is CBD. And it's not because of a Facebook group that I run. It's basically CBD is so powerful because we have these CBD receptors in our body. So it can help control things like pain and insomnia and anxiety. And so that is actually probably my number 1 supplement. My number 2 is these short chain fatty acids. The new research shows that it's amazing healing potential for the brain and the gut. Glutathione. Glutathione is our body's number 1 major antioxidant, and our body produces it. But there's some people that our toxic load is so much, we can't produce enough. And if so, then we have all this oxidative stress. And if you remember that threshold of firing neurons, the more oxidative stress, the shorter the neurons become. So glutathione is up there with my top. Turmeric and resveratrol are great anti-inflammatories. Omega-3 is a great anti-inflammatory. Vitamin D helps to regulate the immune response. And then I like the B12, B complex, and magnesium. These are my top supplements. Now, I'm going to get into different brands that I like. Some of them, unfortunately, only sell to doctors. So I'm trying to do research where I can find comparable brands. My philosophy with supplements are, if you're going to take them, take good ones. Some of these other supplements you're taking they're not very expensive. They're not expensive for a reason, is because they've been manufactured in China, brought over here, and they have no rules like we have. So there's a lot of heavy metal toxicity in these. So while you're getting good stuff to your cell, you're getting a lot of bad stuff in your cell. So that's why people go, these supplements never work for me. Yeah, they're not going to work. You have to take good stuff. So good stuff, unfortunately, costs a little bit more expensive. We always get penalized for trying to be healthy, but that's just kind of the way it works right now. A couple other supplements I like. These are my mitochondrial supplements. Like we talked about, we need a healthy mitochondria. So acetyl L-carnitine, good for mitochondria, good for the brain. Alpha lipoic acid and CoQ10. And then I mentioned magnesium. They're all really good for the mitochondria. Now, I usually give one formula, which is a mitochondria formula that has probably 6 or 7 things in it. So it's a lot cheaper to buy one formula than buying 7 different things. And then, you know, as you start to figure out what your issue is, you have to target the area that you need. So if it's adrenal support because you're, you know, chronically tired or stressed, do you need liver detoxification supplements? Do you need things to help you with elimination for gut health, mitochondria? That part's going to be hard for you to figure out. Your doctor, they don't look at it like this. They're not going through, oh, well, let's see, you have peripheral neuropathy and it's due to your liver toxicity. They're looking at like, oh, you have, you know, small fiber neuropathy. I'm going to give you some gabapentin. You know, see ya. It's there's not going to be a lot of time spent in coaching the diet and lifestyle. This is the important stuff that's going to get you better long term. And then it's very important to know that every single person is different. So your symptoms might be similar, but the cure or the treatment is slightly different. So the more specific you are for you, the better results you're going to get. These groups that say, oh, take these 8 supplements and cure neuropathy, it drives me crazy. It's so not true. Yeah, there's a couple supplements in there that might make you feel a little bit better, and there's some of the things that I just mentioned, but you have to figure it out for you. So, you know, I'm a functional medicine doctor. That's when functional medicine doctors come into play. They need to look at your labs. They need to determine, do you need any other testing to figure that out, and then get a plan together so you can actually get better. In my office, I like to run DNA also. So that personalized the treatment to you. So we look at, does your body have a problem making glutathione? Do you have the right detoxification genes? So like the CYP genes, they're called the cytochrome P450. Those are the genes that help to actually break down CBD. So we want to look at the whole picture to give the best possible advice and then hopefully the best possible outcomes for each individual. So some labs are run. I don't do this on everybody. I try to keep costs down because most of these are not covered by insurance. So I like to run the DNA through Ancestry.com. I like the organic acids test, a GI like gut microbiome test, chemical toxicity, heavy metals, food sensitivity, autoimmune profiles. Sometimes in certain situations, I look at brain antibodies. And then we do a very comprehensive in-office exam that we analyze those sensors. We look at temperature, pressure, light touch, pain to determine are those sensors functioning properly. If not, we give you exercise to build those back up. Use it or lose it. And then we evaluate brain function and vagal turn, the sympathetics or tone, the sympathetics and parasympathetic balance. We do telemedicine, which basically I treat patients or consult with patients worldwide. So most tests you can do through any country now. Most of these labs have different things set up. And then we'll put people on, depending on what their findings are, 1 month, 3 month, or 6 month programs to get them better. If you haven't, order my book on Amazon, Understanding, Managing, and Improving Your Peripheral Neuropathy. It'll give you basically a good understanding of why and how we look at the whole body to help with your chronic pain. You have to do a whole body approach. You can't do oh, your lower back hurts, take this. And yeah, it might be better for a week, 2 weeks. There's going to be a rebound phenomena. Then it's coming back and it's going to be a little worse. So you need to really treat the whole body, and then you have a much better chance of improving.